So, welcome to another episode of B4B TV, where we bring you real people, real issues to deal with those things that people of Bradford are usually concerned about or interested in. Most people will just watch and skip by, but if you really want us to bring more content, please do share, subscribe, and like, and where possible, even enter some comments, giving us some ideas about those things that you wish us to explore and bring to you. So this time we've got the issue of community health checks, and again you are furnished with some brilliant guests. So I will let my guests introduce themselves straight after me. So I'm, as you will know, Shahid Islam, Senior Research Fellow and Vice Chair for Bradford for Better. Ciaran O'Neill, Dr. Ciaran O'Neill, do you just want to introduce yourself, please?
Yeah, so hello, I'm Ciaran O'Neill. I'm an emergency medicine doctor from Bradford. So I live and work in Bradford, and I'm currently working with yourself, Shahid, on a project to improve people's heart health in Bradford.
Thank you. And Dr. Fozia Hayat?
Hi, I'm Fozia Hayat. I'm one of the consultant anaesthetists at Bradford Royal. I've got subspecialist interests in vascular anaesthetics and obstetrics, so that's babies and limbs and legs. But also I do a lot with regards to pre-assessment and looking at people's risk for anaesthesia and general well-being.
Brilliant. Welcome to you both. So, Ciaran, if I can just start this conversation by thinking a little bit about what the need is in Bradford and things like, for example, excess deaths. Because one of the things that you and I have talked about previously is I, for example, am seeing a lot of announcements on things like Janaza Facebook page where lots of people are dying, and usually you would associate those people with having a younger age and they're dying at. And there's also lots of people, if you walk into the graveyards of Bradford, younger people are dying. And we're also seeing data from hospitals and practice in general where people are getting ill. What is your feeling? What's the data telling us?
Yeah, and I think your experience in the community kind of probably tallies with what we see in the hospital, which is people who are too young having heart attacks and strokes. And actually, that's backed up if we look at the data of Bradford in terms of deaths and people having heart attacks from strokes. We see that those people are often too young, and it's much younger in certain areas of Bradford compared to other parts of the country. There's lots of reasons for that. But actually, what we know is that from the data, a lot of this death is preventable. And it's preventable by, things like improving people's blood pressure and improving people's risk that we can address.
Yeah, that's really good. If I could start off with one solid example, and that might really help our listeners. So if I can just go back to summer of last year, so it was actually 26th of June, 2022. I was at the Bradford Literature Festival, and I met a friend there, Shadim Hussain, who is well known across Bradford as a community activist. He's a CEO of My Foster Family. We kind of enjoyed that literature festival event, and then after that we went to have something to eat. The morning of that event, he went for a run, fit as a fiddle character, well known for his cycling and running. And then after that event, we went for a bite to eat at the local eatery, enjoyed that. He went home, I went home, and then I got a text message to say Shadim has had a brain hemorrhage. And it was so serious. He was in ICU, and he stayed there for quite a few weeks. In the first 36 hours, maybe 72 hours, it was looking touch and go. He looked quite serious. He's now in rehabilitation, but the first 5 weeks of that was a nightmare for the family, for his organisation, for the hospital, for everybody. And everybody kept on asking me, because I was one of the last people that he was with. They were saying, did he have any signs of headaches, or did he show any symptoms? Did he show any disorientation? And my answer to everybody was, and remains, is that no, he didn't have any of these symptoms. He was fit, he was well, he went home happy, and then suddenly this happened. So that stemmed purely from high blood pressure. And so the question I would like to ask either yourself, Ciaran, or to Fozia then, is how common is that, where somebody who looks well, is fit, doesn't seem to be showing any symptoms, can be having high blood pressure, no symptoms, and then end up seriously ill. How common is that?
Kieran, shall I take this one to start off with? So I think, I'm sorry to hear that, Shahid. It's awful when something like that happens, but unfortunately it's quite common where it's undetected, because blood pressure is one of those things that if we're not got a good sort of healthy lifestyle, we may have a high risk to develop high blood pressure. Now, you may then say, well, actually, this chap was quite active and he was having a healthy lifestyle, but there's a genetic factor to it as well. And I always say, like, a person's like a house. So if the foundations aren't good, for whatever reason that might be, whether that's because diet, exercise, genetic predispositions, ethnicity, lifestyle, stress, all these things play a part into our in our body, how it works. And it's the same as a house. A house, if it's not got good foundations, the plumbing's weak, the electrical circuit's got a problem in it, problems will slowly build up until it comes falling down. If there's a big event, suddenly you might find that the house falls apart, say in an earthquake or something. And it's like that for the person. There might be a big event which then, the problems then show. So it's all about managing those basic issues and those basic problems. So I guess we all need to have some responsibility in our diet, our exercise, but also looking at our family histories, what is common in our families, what is, what are we more predisposed to, and certainly as being Asian and Scottish, from the nature and nurture side of things, I know I'm at high risk of high blood pressure problems. I know I'm at risk of diabetes. So therefore I have a personal responsibility to try and manage my lifestyle, but also at the right times get checked, get looked at, and have my blood pressure managed, because it's such a simple thing that we can actually look at and manage. And
what is blood pressure then? At a very basic level, for those who are not aware, what exactly is blood pressure?
So again, blood pressure, sorry, Ken, I'll take this one again. So blood pressure is like, it's a plumbing system, okay? So the heart, the lungs, the liver, all the major organs, I call it like our plumbing system in our bodies, okay? And it's like pipes. So pipes have flow and have blood that goes through it in terms of our vessels. And that pressure can go up or down. And when it goes up more than anything else, it can be serious and detrimental. So the heart's a pump. The pump creates pressure. The pressure then has to we need a certain level of good pressure to get blood to all the cells and all the organs in the body. And within a certain blood pressure, that's good. But when the blood pressure goes too high, it can start to have detrimental effects. It can be a problem for all those little cells in the body and eventually the organs. So the kidneys can become affected, like in the case of your friend, it can cause hemorrhages and strokes, and so on and so forth.
Yeah, that's a really good analogy. So thinking of it like a plumbing system, that makes a great deal of sense. So Ciaran, if you would be happy to chip in, give us some examples of when it does go too high and it goes wrong. What kinds of things might happen?
Yeah, so the important thing, and I think Fozia mentioned there, is that often people don't know that their blood pressure is high. So even when your blood pressure is high, it might not have any symptoms at all. And there'll be people walking around Bradford at the moment who have very high blood pressures, and they may not have any idea that they have it. But when it is high, especially when it's high for a long time, it increases your risk over months and years of having mainly heart attacks and strokes. So in Shadim's case, your friend, that was called a bleed on the brain, which is a type of stroke. And that, I think you mentioned to me, was a result of him having undiagnosed high blood pressure. So it's really important to get it checked. But there's other problems that it can cause as well. And that's problems with other organs. So problems with your limbs, problems with your kidneys, and other problems. And it causes problems all over the body, really.
Okay, so get it checked is a key thing. Now, one of the things that people will say, it's not easy to get into your GPs to get things checked, especially when there's no symptoms for anything going wrong. How else might people get blood pressure checked?
So there's a few different ways you can. So often people wouldn't book in with their GP just to get the blood pressure checked, but often in GP surgeries, if you were there for a different reason, there's an opportunity to get your blood pressure checked by either opportunistically by a nurse, or there's sometimes in the waiting room. There's also an excellent service at the moment in community pharmacies where they're offering blood pressure checks. So it'd be worth checking any of your local pharmacies if they are offering them. And you just have to pop in and ask your pharmacist about that, and they can refer you back to your GP if you were to need further treatment. And then there's also several projects in Bradford at the moment which are offering health checks in places like community centres. So we're currently working on a health check programme in the Manley Centre in BD5, but I'm aware of other projects that are going on in Keighley and also in BD3. So there's lots of opportunities to get your blood pressure checked. And, you know, as doctors, we all want as many people to get their blood pressure checked as possible. Because we don't want it to get to that stage where people are having a stroke or a heart attack.
Ciaran, you can probably, sorry to interrupt there, Shahid, but I think there's also, I might be wrong here, are there projects within Bradford where certain GP surgeries can offer patients blood pressure machines for a short period of time? I think there are some areas that have that facility.
Okay. There is, yeah. So I'm not sure which GP practices are doing that, but certainly they are loaning out and giving out blood pressure monitors for people to keep an eye on their numbers at home, which is really important.
And within our families, they're quite big families as well. There will be somebody that has a blood pressure monitor at home that's bought it and not using it. And actually, it's really useful for you guys to share that amongst yourselves, and actually you can monitor over a certain periods of days, a few days, and at different times of the day as well if you are concerned. And if you have a diary, and you take that to, you know, your local practitioners, that's more useful than a one-off reading.
Yeah, that is something that came out as a result of Shadim's case, where some people said they actually bought something and kept it at home and shared it between family members, and that might be the way in the future to do it. So if I can move us on slightly then onto a subject which Fozia you've touched on, which is diabetes, which is, I think, equally as important as high blood pressure. So if I can ask Fozia just to, in a small nutshell, just describe what is diabetes when we talk about it.
So I think certainly in a lot of Asian families it's referred to as sugar, and that's in some ways slightly correct because basically the blood becomes quite thick to some extent, and essentially it's to do with the insulin. So it's a hormone within the body that's affected because of the amount of glucose in the body. And to try and simplify it, essentially, like blood pressure, it's a whole machine, all the organs are connected, and it can affect blood supply to the organs and how well the cells metabolize, which means how well they use energy and how they use energy. That's me trying to explain it simply.
That's really helpful. So Ciaran, if I have diabetes, or if anybody has diabetes, how important is it for them to know that they've got it?
It's really important because similarly to blood pressure, and Fozia mentioned there, the blood can be sticky, and in a general sense that can cause problems with the blood vessels as well. And very similarly to blood pressure, that can cause heart attacks, strokes, and problems with kidneys, arms and legs. It's really important to know that if you do have diabetes, it's probably important to mention, it's really important to know if you're in the earlier stages of diabetes, or what we can call pre-diabetes, which is when your body is starting to show signs of type 2 diabetes, but hasn't quite got to the stage where you have diabetes yet. And that's a kind of critical moment, because there are things you can do in that stage to reduce your risk of developing the complications of diabetes, and even in some cases reverse diabetes so you don't develop diabetes.
All right, so there's two things there. I'm going to ask Fozia about this then. So firstly, some people think, well, actually everybody in my family has diabetes, therefore I'm going to get it. It's kind of almost predetermined. How much of that is a myth?
So I think it's like I said before, there are things that influence it. So it could be your diet, exercise, lifestyle factors, but also your genetic factors. I think there is a bit of apathy. So essentially people are like, well, look, lots of members of my family have got it. If I get it, I'll be fine. But actually it has such detrimental effects on our health, and it's often interlinked with high blood pressure. And if you have both of those things, it can cause a lot of problems. But I also think there's the other side of the spectrum, Shahid, which isn't talked about as much, but I think there is a little bit of stigma still if you have diabetes, and I think there is a fear sometimes of being tested, because I know of people in the community who've had amputations or gangrene and all sorts as a result, which is the end point of diabetes really, where it gets really bad, and there's definitely a stigma there. And so I think we need to have more discussions about it. I think we need to be more proactive and take that ownership about our health and well-being. And just touching on what Ciaran said, I don't feel agree with me here. I think the pre-diabetic stage is so important. So that early intervention will reap rewards, and we all have a responsibility for ourselves. There's often a thing of what God wills, but actually we have to take personal responsibility for our health and well-being. And in diabetes and diabetes checks, we can do that. We can actually, if you have got high risks, if everyone in your family's got it, you can still prevent yourself from having it by changing your diet and looking at how much exercise we can do. I often hear from friends, family and patients that time's a problem. Families can be an issue because we have lots of family members and lots of people to look after, and the stress that's involved in that. The stress itself can actually increase the chances of these things as well. So it's about trying to manage that and discuss it within our families, how we can all change our lifestyles and adapt to improve ourselves.
So if I'm at the pre-diabetes stage, are there any symptoms that I would be aware of, or does it depend on me having a test?
So at the pre-diabetes stage, it would be unlikely you'd be having any symptoms from your diabetes. So the important thing is, if you know that you're at higher risk of having diabetes, for example, if you had a family member who've had diabetes, like your mum or your dad, it's important to understand that risk and think about getting tested. There's some quite good tools online you could use to understand whether you're at risk of diabetes. So if you're thinking now, my dad's got diabetes or my brother's got diabetes, there are tests that you can take online, not tests as such, but risk questionnaires that you can take, and that'll give you an idea of how high your risk is of diabetes, and then you could potentially think about going to get tested at your GP.
I think that's a really good point, Ciaran, that you made about online resources. There's lots of good stuff online, but there's lots of false stuff online as well, isn't there? And I think one of the great things about resources that are available to us and are underutilised are charities. So there's the British Heart Foundation, if you wanted to find out a bit more about your risk for blood pressure and what support there is and what you can do about it. So there's lots of online resources, but I'm sure there's lots of places within the high street that we can go into and find out more information. Plus there's the diabetes charities as well.
Yeah, so I was just going to mention Diabetes UK is where you can plug in some numbers that you probably know yourself, and you can get a risk assessment.
Now, one of the things that I remember quite vividly, one of the A&E consultants sharing with us at the time when COVID was really rife, where lots of people were being admitted, and he said he thought that COVID might have been actually causing diabetes. There were that many people coming in who had COVID, but didn't know they had diabetes. Of course, it wasn't caused by that. It's just that there were lots of people out there in the public who had diabetes and just didn't know about it. And for that reason, it made me think, how can we actually keep on top of this? And the trouble for a lot of people will be, and it's a little bit like the blood pressure conversation we just had, how will people know what to do and what will prompt them to want to go check? Is it simply a case of a member of my family having it and therefore predisposing me, so I better go get checked? Or is there something that I really need to have as a marker and then what do you think it is?
I think it's about communicating and just talking about these things, actually, Shahid. I think, yes, but a lot of our family members have got high blood pressure and diabetes, unfortunately. So that in itself maybe would prompt us, but we all get busy in our lives, and I think this kind of thing is really important. I think as much as the fake news goes around and all the sort of clickbait there is out there, actually there needs to be more positive clickbait about health, health and well-being and what people can do for themselves. It is difficult. There are, lots of hardships out there. There's a lot of things going on in the world that are negative, but actually just having that bit of self-reflection and supporting each other to be more proactive in your health and well-being is important.
So get your diabetes checked. Yeah. So get your diabetes checked, just as much as you'd get your blood pressure checked, and see it as something that can be reversed if detected early enough, which will prolong your good health and possibly your life if managed well.
And I think one of the important, how young some of the patients were who were showing signs of having abnormal diabetes tests, especially during COVID, but even now, I think we sometimes think of diabetes as something that affects people in their 40s and 50s, but we're actually seeing that, diabetes in patients between 25 and 35 in some cases, or showing signs of diabetes, and that's a good time to start thinking about reducing your risk of diabetes rather than waiting until later in life, I think.
I think so. I think it's instilling that positive attitude towards diet and exercise, trying to work it around your day. It's always one of those things when we talk about it, it's easier said than done sometimes. But having worked on, the ICU whilst during the COVID pandemic, having high blood pressure, having diabetes did put you at higher risk. Being of ethnic minority, so being Pakistani, South Asian, did put you at higher risk. Having a higher BMI and having diabetes did put you at higher risk. So if there are things that we can do for ourselves, it should be to sort of manage reversible health conditions like blood pressure and diabetes, and trying to even prevent it, starting young. And unfortunately, our rate of obesity is increasing even in children. So having that from a very early age, I think that education, that knowledge is really important.
Yeah, it's crucial. So if I can move us on to the third topic in an interconnected way, is cholesterol. So Ciaran, this is an area which is equally as important as hypertension and diabetes. Why is that so?
So cholesterol is probably one of the biggest risk factors we have for cardiovascular disease, and by that I mean heart attack, stroke, and problems with the blood vessels in the body. And having too much bad cholesterol can cause a blockage in the blood vessels, and it's almost like having a blockage in the pipe. It puts added strain on the blood vessels, and they struggle to cope with the demands of the heart pumping blood around, and that can lead to problems, and predominantly problems with heart attacks and strokes. So it's really important that firstly we understand that having too much bad cholesterol is bad, and there's things we can do to address that, and that's things like keeping your weight healthy, your eating healthy, and doing some physical activity when you can, and also understanding that if you are at higher risk of having high cholesterol, there are medical treatments that can reduce your risk of having complications of high cholesterol.
Yeah. So these three things that we've talked about have a certain commonality, don't they? That if they're not unchecked and untreated, they lead to all sorts of health complications, and sadly, in some cases, death. And so cholesterol is just another one of those. How do you test for cholesterol then?
So again, it's a blood test. It's a simple blood test, and it could be taken along with all the other blood tests that you often get at GP checks, and they will measure different types of cholesterol levels. So there's a good cholesterol and there's a bad cholesterol. So some level of cholesterol is good for you, but it's not the bad type of cholesterol, and that's what we're looking for. We want to reduce that. And actually, it's found that exercise is one of all the other things, the diet, the keeping your weight within a normal level is important, but actually exercise can reverse the amount of high cholesterol. So higher cardiovascular exercise. What I mean by that is things that get your heart rate going. So a lot of us don't have the time to go to the gym and go running, but actually climbing the stairs 5-6 times a day in a row, that's enough to get people's heart rate up. So when people say to me, I don't have time for exercise, if you've got stairs to your flat or stairs within your house, going up and down them several times is enough to get your heart going and putting that little bit of pressure on your heart to get it moving and sort of try and reverse these sort of problems is important.
Yeah. So eat well, exercise, get your health checked, and hopefully many of these problems can be resolved. But yeah, exercise is a key one. Now, when somebody has high cholesterol, it doesn't always necessarily mean that they'll need medicine. It can just simply be a case of changing the diets and doing more exercise. Is that the case? Yeah.
Yeah, I am a self-renowned chocoholic, and I had slightly higher than I'd like cholesterol, and I've managed to bring that down, probably by reducing my chocolate. Or people around me might say that I've not quite reduced it enough, so it's doable. You know, you have to just look at what's the problem, where can you address it, and how can you do it. So, for example, if you're using ghee in your cooking, substitute that for olive oil. If you're using olive oil, just use a teaspoon less, you know. Try and make those small changes, and gradually those small little changes will make a big difference.
Yeah.
And
No,
I think that's a really important point, isn't it? Something, it was similar with activity and physical activity and cooking. Something is better than nothing. And I think we often have an all or nothing approach to it.
Yeah.
You know, if you're not doing 2.5 hours of exercise a week, it's not worth doing. But even those small changes can make quite a big impact in the long term.
Yeah, no, that's absolutely fabulous. So one of the things that we're trying now to do is create an awareness about people's own health and letting them take ownership of, you know, how they look after themselves through Bradford for Better and indeed through Bradford Institute for Health Research. So we're currently working on some projects where people will be able to come to, for example, like Ciaran mentioned, to Mudney Centre in the very near future and have some health checks done. We might even get people there to give some advice on things like cycling and running and exercise generally, and perhaps cooking. So I just want to sort of share with our listeners today. If you hear of health checks taking place in your community, please do engage with that. It may even save your life. It could be one of those things. It will certainly give you somewhere to learn a little bit more about these things that we've discussed today. And I think, Ciaran, that's something that we want to spread a lot more of, isn't it, across the district of Bradford?
Yeah, absolutely. Yeah, you know, we want to start this conversation and get people to understand that these things are really important in reducing people's, people dying really too young. But I think it's also really important to be able to connect people to services that can help them. You know, as Fozia said, these things are quite difficult to change. We all have a responsibility to try and change these lifestyle factors that can impact our risk of having heart attacks and strokes. But there are really good services available that can help you to do that. Things that might help with free gym memberships to help you exercise and get some advice on that, or healthy eating courses, and even a diabetes prevention program course. And we want to be able to give people the resources they need to be able to address some of these things that are really difficult to change if it's ingrained in your life.
Yeah. And Fozia, if I can let you have the last word.
I suppose I think we need people to engage. We want people to feel that they can speak up, give people a voice. We know it's difficult. We know that people are facing lots of hardships. We know that people have got busy lives and lots of responsibilities. And I think that everyone's included within this. So I want to see, all members of the family coming in, getting their health checks, and taking advantage of this really, really beneficial resource within the community.
Brilliant. Thank you to our guests today, Dr. Ciaran O'Neill and Dr. Fozia Hayat. Final word to our listeners and subscribers. Please do subscribe, please do share, and please do like, and also leave some comments and share with us what else you would like us to cover in future podcasts. Thanks for listening. Goodbye for now.
Thank you.
Thank you.